Angau is a hospital in crisis. Its buildings have literally crumbled under the onslaught of millions of termites that have eaten away the walls and the foundations of this once proud hospital. Now it's facing a new challenge. Staff at the Angau labor ward are seeing the impact of a population growth that is spiraling out of control.
Plenty time mon mama come because delivery blow you me now go antava me talk osem last 4 years you miss all mama carry 4,000 mark long 4,000 now after 4 years 2012 me play go 8,000 finish so close to one year 1,000 more mama only come carry lo Angau.
At the antenatal ward, all the beds are full. 2 women and their newborn babies currently sleep on the floor as they wait for others to be discharged.
All mothers who said deliver finish, all no bed to sleep. So all sleep number to float as well.
The nurse in charge says usually the floor is occupied by women who don't have a bed. Every day between 30 and 50 babies are born, and not all of them arrive in the labor ward. Behind me is the labor ward. That's the door at the far end. We haven't been given permission to film inside the labor ward, but what we've been told is that at least 3 women have given birth on the floor in the last 3 hours because there aren't enough beds. The midwife says they can barely cope with the increasing number of births every day.
Santo al karim lo shower room, al karim lo toilet, al karim lo corridor ya, al karim lo all geta hap.
Angau is just a sample of a nationwide birth rate. In 5 to 10 years, Papua New Guinea's population will reach 10 million. While health practitioners are talking about family planning, critics say Papua New Guineans should now be using the word population control. Meanwhile, the board and management are trying to convince the government to approve a 65 million kina design proposal for a new hospital that takes into account the need for more staff and more beds.
In the design of the hospital, we have not only taken into account the clinical component, but all the other support services that can make the hospital fully functioning.
Angau's chief executive says the hospital can't be redesigned unless the National Executive Council gives the approval. Scott Waide, National EMTV News, Lae.